I'd just like to thank the organisers for this workshop for inviting me to present today on an area that has been the interest of my research for quite a few years now. And that research really comes from an interest in the issue of childhood obesity. So we know that this is not an issue that is just in Western countries, but is affecting children worldwide, with 43 million children between the ages of 0 and 5 years being classified as overweight. And certainly within Australia, where I'm from, we have 21% of Australian 2 to 3 year olds also being classified as overweight. Now, we know that there are both short and long-term adverse outcomes associated with childhood obesity, and we also know that rapid early growth in the first 2 years of life and higher weight status in childhood track into the adolescent and adult years. So really, the need to intervene early to prevent childhood obesity is clear. The other factor that's worth considering is if we're thinking about nutrition and eating behaviours, which is what I will focus on today, that establishing good healthy habits early on, in establishing healthy patterns of growth early on, is going to be much easier than trying to change entrenched habits at a later age. And reviews of the literature have concluded that trying to prevent childhood obesity or intervene are often unsuccessful or have limited success because it is difficult to change these entrenched patterns of poor nutrition. Now, I'd like to focus on eating behaviours in particular and children's ability to self-regulate their energy intake. So studies have indicated that young children at least have an innate capacity to learn to be able to self-regulate their eating behaviours and their energy intake. And infants who are fed different energy densities of formula are able to successfully adjust their energy intake over a period of days, which is demonstrating that good self-regulation. We also know that young children can adjust their ad libitum intake of a meal in response to different energy preloads. So again, this is demonstrating this capacity for young children to be able to successfully self-regulate, or, as some people talk, intuitively eat. However, and as I'll go into more detail, this is something that begins to really erode with age. So the older children get, more often than not, what we see is this reduced capacity to be able to self-regulate their energy intake. So that brings me to how children's eating behaviours develop, and certainly we've had some wonderful presentations already that have looked specifically at the development of taste and texture preferences. And so what I'll focus on is more these eating behaviours regarding appetite in particular, but also to some extent fussy eating behaviour. So a lot of research in this field has made use of a questionnaire called the Children's Eating Behaviour Questionnaire that's been developed by researchers at UCL in the UK. It's certainly widely used and has been validated in a number of different populations cross-culturally around the world. And it's essentially divided into 4 food approach eating behaviours and 4 food avoidance eating behaviours. Now, the authors more recently have been talking about these eating behaviours as appetitive traits, and the reasoning behind that is through twin studies they've identified that at least some of these behaviours appear to have a strong genetic component, and so they are not necessarily behaviours that are going to be similar across all infants, but there will be that individual variation from early on. Now, I won't go into all of those 8 eating behaviours that are assessed in the Children's Eating Behaviour Questionnaire, but really I want to focus on just a few that seem to be primarily of interest to researchers and probably most important for, within the context particularly of childhood obesity as well as dietary quality. So food responsiveness is an approach trait that is related to children's capacity to kind of continue to eat or want to eat food just because other people might be eating it, or there's food available at a party. So this is the child who will go up to the party table and continue to eat and eat and eat. In contrast to that is the eating behaviour of satiety responsiveness. So these are children who, will get full quite easily, will eat more and more slowly over the course of the meal, and basically are displaying these satiety mechanisms. Now, how parents might perceive these two children is sort of up for debate. And certainly children who are food responsive and children who are good eaters may be seen as parents as not the problem at all. On the flip side, children who are sensitive to those satiety cues might become a source of frustration for parents because the parents might want them to eat more. But we can think of these two traits as reflective of appetite. So a child with high food responsiveness and low satiety responsiveness has a big appetite, and there's certainly a genetic component to this. We also know that these eating behaviours in early childhood are associated with BMI, so food responsiveness with higher BMI, satiety responsiveness with lower BMI, and they are also predictive of changes in BMI over time. Now, food fussiness is another eating behaviour that I think has already sort of come up a few times within the questions, and I'm certainly would like to refer to Lisa, who'll be talking later about that. But food fussiness, as it's measured in this children's eating behaviour questionnaire, really captures elements of both neophobia, which we've discussed already this morning, as well as that kind of picky eating behaviour. And so the distinction there, as I've interpreted it, is the difference between being fussy about foods that the child's never tried before, so that's the neophobia aspect, versus the child just being fussy in general in terms of what they will eat or where they will refuse to eat even familiar foods. So it has a strong genetic component and is associated with food preferences, particularly a low preference for vegetables and fruits to an extent. Okay, and I guess this is where eating behaviours change over time, but as children age, what we can see is that those food approach behaviours, particularly food responsiveness, tend to increase, and food avoidance traits specifically around appetite regulation, such as satiety responsiveness or speed of eating, begin to decrease. A study that one of my now PhD students did in her honours year was looking at the eating in the absence of hunger paradigm. So for anyone who's not familiar with this, it's where we give children a large meal. They eat to the point where they report that they are feeling full, or in our case, many children said they were very, very full. And then 15 minutes later, they are given access to a range of what we would call non-core foods. So these are your snack, junk, unhealthy foods that are high in salt, sugar and fat. And we assess how much of those foods the children eat. So our study was with a fairly small sample of high socioeconomic families. The children were 3 to 4 years of age, and none of them were overweight or obese. And yet all of those children displayed this eating behaviour of eating in the absence of hunger. So they all reported that they were very full after the meal, and all of them ate at least some of the snack foods provided, and some of them cleared us out completely and ate everything. So what that really shows is that even in very young children, this capacity to self-regulate, at least within the time frame that we were looking on, seems to be disrupted. A recent study also came out, a twin study looking at emotional over and under eating, and found that there's actually no genetic component for these eating behaviours in young children. And emotional overeating is a particularly worrisome eating behaviour that's associated with higher BMI and does increase as children age. So the real question then for me has been, why do children lose this ability to self-regulate their eating behaviours, and why do they learn to eat for emotional comfort? And I think looking at the role of parents, because they are the gatekeepers of, children's nutrition in those early years, I think is an obvious area to investigate. And in particular, the role of parental feeding practices, or what we might sometimes also talk about as child feeding practices. And certainly when this area was first being explored, particularly by Leanne Birch, she was very much focused on the level of control, and that excessive control in the context of child feeding could lead to obesogenic eating behaviours and the development of overweight and obesity problems for children. In terms of parents' role, we can also extend that to looking at their own eating styles. Mothers who have concerns about their own weight, display dietary restraint, have shown to use less adaptive feeding practices, which can negatively impact the child as well. But I really want to focus more on the feeding practices in today's talk. And so certainly, just to start with the definition of child feeding practices, we can think of these as specific goal-directed strategies or behaviours that are used to control or modify the child's eating behaviours. And I think it's very important, particularly in this cross-cultural context that we find ourselves in, to think about the role of culture and tradition in those feeding practices. And certainly many feeding practices have evolved in a time of relative food scarcity, where those practices that are related to trying to coerce and encourage children to eat are something that potentially don't make as much sense in our obesogenic and food environment. Just on that last point, even on the way to the airport when I was travelling from Brisbane, the cab driver took a great interest in this topic. He has a 2-year-old, and he said, my mother-in-law just keeps coming over and, telling me how I should feed my child. And I'm trying to say times have changed. And I think that that's the difficulty many parents are facing, not so much the mother-in-law, but just, understanding what is going to be best for their child. How should they feed their child in today's world? Now, an Australian study that looked at feeding practices in early childhood, came up with some results that really are not surprising when you look at the wider literature. And that's that children's exposure to these non-core foods is very high, and they have low fruit and vegetable intake, even before the age of 2 years. We also looked at, in this study, the role of kind of those coercive feeding practices that are very controlling, and they were prevalent, as was the emotional use of food by parents as a way to soothe their child. And so it comes to this point that, we really do need new evidence-based approaches to feed children in a way that's going to help preserve their capacity to self-regulate energy intake in a current food environment where there is, a high availability of nutrient poor and high energy foods. Okay, so I want to focus now on where the field has moved since the advent of sort of controlling feeding practices, more to something along the lines of responsive feeding. So feeding that's responsive is where the parent is paying attention to the child's cues, particularly around their satiety and hunger cues. And I think this was when someone had the question about baby-led weaning, I thought this really plays into this idea of feeding in a way that's developmentally appropriate for that child. So if the child's not able to fully, feed themselves, then I certainly from this perspective think that spoon feeding is not inappropriate by any means. The second point of responsive feeding is that it's not controlling, it's not coercive, and it's not overly intrusive. And thirdly, that it is those prompt and appropriate responses to infant, child and hunger satiety cues. The other element, or the much forgotten element of responsive feeding that I think is also critically important, is about providing structure or limits around meal times. And so this can involve, having meals at reasonably regular times and in certain places. Also, eating foods together as a family. And so this is where parental role modelling can really come into play. So it's difficult for parents to role model healthy eating if they're not eating with their child. So not having separate meal times or separate meals to the child is critically important here. And then the mealtime setting. So again, there would be cultural variation, but certainly eating in front of the TV or letting the child just wander around and sort of following them with a spoon of food are not, within this idea of responsive feeding. So the hypothesis is that non-responsive feeding will undermine children's ability to self-regulate their intake, and this would be shown through an increase in obesogenic eating behaviours that indicate poor self-regulation. So things like food responsiveness and emotional overeating are those sorts of behaviours. Now, I do have some slides relating to my own work, but I really want to present a kind of broad brush overview of the current state of the literature with relation to a few specific feeding practices. And so the first one is pressure to eat, which is where parents are coercing the child to eat particular foods or to eat more of a particular food. So that's my little boy there with his father's safety gear on his head in a sort of very defensive kind of action to dinner. Okay, so we know that, at least cross-sectionally, pressure to eat is associated with a higher intake of sweet and savoury snack foods. It's also interestingly associated with lower BMI and lower enjoyment of eating. And in general, it tends to be associated with more food avoidance eating behaviours, particularly food fussiness or neophobia. Now, many of these associations that have been investigated in the research are cross-sectional, so we don't know whether the feeding practice is causing the eating behaviours or vice versa. But what I would like to kind of interpret or suggest from this data is that it may be that this pressure to eat strategy is something parents use when their child is not eating. If their child is a bit smaller, if their child is fussy, they may be more inclined to try to pressure that child to eat certain foods. So the extent to which pressure to eat influences child eating behaviours, I don't think is really clear from the literature yet. But what we do know is that it is associated, as I said, with sweet and savoury snack food intake, and can also be associated with a lower preference for the foods that the parents are trying to pressure the child to eat, which are probably going to be vegetables. Okay, instrumental and emotional feeding. This is where parents are using food as a reward, which we've already heard is a big no-no, but I just want to reinforce that fact, or for emotional comfort. And both of these practices are associated with more emotional overeating, overeating in general, and greater snacking behaviour. And importantly, these have been prospectively associated with a higher BMI in children, as well as higher food responsiveness. So I think that there's clear evidence that instrumental and emotional feeding contribute to that increase in obesogenic eating behaviours that we see in children, and certainly with the evidence that there's no genetic component to emotional overeating in children, we can certainly point towards this feeding practice, or these feeding practices in particular, as teaching children to eat as a way of coping with negative emotions. Okay, I'll move on now to the idea of restriction. So restriction was originally conceptualised as one of the controlling feeding practices that could contribute to overweight and obesity. And I would say that it is reasonably poorly defined, but it's when parents are restricting what and how much children eat. Now, one of my PhD students, a different one this time, she's actually doing her entire thesis on the restrictive feeding phenomenon and really trying to understand it a little bit better. Certainly, what she has identified is that there is a common list, I guess we could say, of foods and drinks that parents do aim or target for restriction. So things like soft drinks, lollies, chips, cakes and biscuits. This is what parents are restricting. Parents also feel, I guess, a little bit confused as to whether they should restrict or not. And the main issue is that if they restrict their child from eating these foods, will the child just want them more? But on the flip side, we know about the importance of early exposure, and an early exposure to these sorts of foods can lead to a high intake and preference for them later on. So, parents might at the same time think that perhaps they should limit the child's exposure to these foods altogether. In terms of what the evidence suggests so far, restriction has been associated with more food approach eating behaviours, including eating in the absence of hunger. However, a lot of these studies have found that this effect may only be seen in girls, for instance, and only girls who are already at risk of obesity. And there's certainly some evidence that shows restriction may have protective effects on children's BMI and their eating as well. So I think that this is an area that we really need to understand and explore a lot more, and certainly start to think about maybe it's more how parents are restricting, what they're saying to their children that's important, rather than whether they limit or don't limit certain foods. And then finally, I would like to talk a little bit about, the structure of the meal times, which is an area of child feeding that has, received patchy attention at best. And I think, what's encouraging though is the really positive influence this is likely to have on children's capacity to self-regulate their eating and to enjoy eating. Structure of mealtime can include things such as providing structure around meals with regards to the time, the setting of meals, so having them at the table as a family, not in front of the television, and really to eat with other people. Now, certainly for practical considerations, parents might find that it's easier to feed the kids first and have their own meal separately, but what I guess we're really trying to encourage here is the idea that the family eats together. And I think Sophie's presentation about that sort of socialisation, really points to that fact. Now, what we've seen in terms of the role of structure is that it's associated with less fussy eating behaviour, more enjoyment of food, and less emotional eating in children. So these are all really positive outcomes. Okay, I'd like to move now on to the issue of bidirectional effects. So up until now, we've really been considering feeding practices as something that can impact on children's eating behaviours. But more and more recently, researchers have looked at, feeding is a conversation or a bidirectional relationship between parent and child, and how the parent reacts or responds to the child is likely to be influenced by, the child's own unique characteristics and their own eating behaviours. And so the question that a number of researchers have looked at is, do parents respond to child overeating behaviours in particular? So the child who is more food responsive or emotionally overeats, do parents respond differently? And I'd say at this point the evidence is maybe. So a study by Rogers, and these are all longitudinal studies that are trying to look at cause and effect relationships. Rogers found that child overeating and emotional eating behaviours were prospectively related to increased instrumental feeding and emotional feeding practices by the parents. However, a study by Steinsbeck found that, as I've said already, instrumental feeding was prospectively related to greater child food responsiveness, but there were no child-driven effects. So child eating behaviours did not prospectively influence a range of parental feeding practices that they investigate. So that would indicate that, maybe in this case, parents aren't necessarily responding to the child's eating behaviour. And to sort of support that point of view, a study that I was involved in by Janssen that was published this year showed that, again, greater instrumental feeding was related to greater food responsiveness, but food responsiveness did not predict feeding practices. In this last study, we actually had 3 time points, so age 2, 3.5 and 5 years, where both feeding practices and eating behaviours were assessed. And so within that time period at least, we didn't find any evidence that parents adjusted their feeding practices in response to a bigger appetite of the child. However, what we've sort of examined is whether perhaps parents aren't necessarily going to respond to these characteristics that may be, perceived as a good eater, so the kid with the big appetite, but rather parents are going to change their feeding practices when they have a child who is refusing food, whether because they have a small appetite or whether because they're a fussy eater. And so this child, the kind of poor eater or the bad eater, is the one who might really prompt some less than ideal feeding practices as parents try to manage that behaviour. So in the same study by Jansen, we also looked at satiety responsiveness, and we did find that higher levels of satiety responsiveness led to more use of restriction, but also more use of structure. So what we see here is that there is a child-driven effect with regards to satiety responsiveness, but potentially it's prompting parents to use more structure around their meal times, which may not necessarily be a bad thing. With regards to the greater use of restriction, well, I think I'm really very undecided on whether restriction is necessarily a good or a bad thing at this point. But certainly, I think the point here is that food responsiveness in that study had no influence on parents' behaviour, whereas satiety responsiveness did. Another study by Jansen, and it's a different Jansen, looked longitudinally at the relationship between fussy eating and pressure to eat, and found that children who are displaying more fussy eating behaviours, their parents are likely to use more pressure to eat in the longer term. And another paper looking at a very similar issue that is under review currently for myself, I found that higher levels of fussy eating prospectively predicted more pressure to eat and also more instrumental feeding in children. And the data that I used for that was the same as for the earlier Jansen papers, where we had data from age 2, 3.5 and 5 years. Okay, so I just want to provide a bit of a summary now and some future directions that I think might be of interest to researchers in this area. Overall, from that sort of broad scoping of the literature, I think that there is certainly general support for that hypothesis I put forward that non-responsive feeding practices might impact negatively on children's eating behaviours. And I think it's especially the case for instrumental and emotional feeding, where these have been consistently shown to associate with greater obesogenic eating behaviours. I think there's also growing support for the fact that structure-related practices are likely to have a positive impact on a range of different eating behaviours. But I think there's certainly a lot of scope for more research and in-depth in this field, and particularly, and I think I could be biased because of my student here, but in the area of restriction. I think that understanding how parents restrict and whether the way in which they restrict makes a difference is worth looking at. Some researchers have proposed the idea of overt versus covert restriction, and so if something's covert and the child's not aware that they're being restricted, that might be quite a beneficial way to restrict food. Whereas if it's very overt, so if the parent's sort of explicitly telling the child, this is delicious chocolate and you can't have any, or you can only have one piece, that might be more problematic. I think also in terms of restriction, we need to think about the social context and children's developing autonomy. And so when children start to become at an age where they're going to parties and there will be these sorts of restricted foods available, how parents manage those kind of situations. And I think also to some extent how parents manage the idea of treats, whether it's food treats that they're giving or food treats that perhaps well-meaning relatives might be giving the child. And I think further exploration about the importance of that child's obesity risk, their own eating behaviours, is something that also needs to be taken into consideration. Following on from those longitudinal studies I showed, I think that we need to look more closely at reciprocal effects between parent and child, and particularly around children who parents will perceive as problem eaters. So giving parents effective ways to understand healthy growth and nutrition so that their child who they think is a poor eater might actually be growing completely normally. So identifying, whether there is a problem or not, but, showing parents how to effective ways to manage smaller appetite and fussy eating behaviour. So potentially that's where the role of structure around mealtimes may play a part. So if a child with a small appetite gets full up, if they eat too many snacks between a meal, then maybe don't give the child the snacks. So feed them when they're hungry, and they may eat what you want them to eat. I think also, particularly we know that these sorts of child eating behaviours are going to prompt things like pressuring to eat and instrumental feeding, or the use of food rewards where, the child can have ice cream if they eat their beans. So really trying to show parents that there are other options, and that there could be quite detrimental effects of using those tactics. And this is probably a more nerdy question, suggestion for people who are in this field, but really I think we need to develop a better way of measuring responsive feeding. So far our current measures measure non-responsive feeding, but that isn't to say that responsive feeding is the flip side or the other end of non-responsive feeding practices. And I think it's also important to try to validate if we're using questionnaire-based measures, which are, economical and can allow us to collect data from a lot of people, making some attempts to validate them against actual observations of parent-feeding interactions with their child. Okay, so I wanted to end just by talking about some tips on responsive feeding practices, particularly because I'm very conscious of the fact that we're often telling parents what not to do, but not necessarily what they can actually do. And my work at Queensland University of Technology with the Nourish randomised control trial has informed these particular tips. So Nourish was an obesity prevention intervention that showed successful outcomes for parent feeding practices, child eating behaviours and child growth up to 5 years. So the content of Nourish was delivered in 2 modules, the first just before weaning and the second at 14 months when children are likely to start to become a bit more autonomous with their feeding and potentially show neophobic tendencies. So at that second time point, the intervention really focused on the notion of parent provide, child decide. And so one of the key messages to parents was to listen to and trust your child in the feeding context, and that the parents are responsible for providing healthy, nutritious foods and to, organising the structure of those particular meal times. But the child is responsible for how much they are going to eat at a given meal. And so guiding parents on issues such as portion size, normal growth patterns, and the fact that children may have variable appetites throughout the day or across different days. And to really move parents away from focusing on amounts or seeing a clean bowl as a sign of parenting success. In terms of, when the child refuses to eat, parents were really educated about recognising this as a sign of satiety, that the child is full, and not providing alternatives. So we know from our data that a lot of parents would provide, say, a milk drink if the child refused to eat their meal. Also, avoiding the use of rewards. Particularly, you can have ice cream after dinner if you eat your veggies, and bribes. Certainly, we also advised against using games. So I don't know whether this is not going to make sense to people, but the aeroplane spoon kind of tactics as a way of encouraging children to eat. Certainly Nourish was not in support of those sorts of tactics, and certainly not pressuring children. The other thing, was to really encourage the child's own autonomy and, encourage self-feeding. So this is not to say this, and I think Andrea's sort of discussion around baby-led weaning was exactly how I think of it as well. But, allow children to start exploring foods with their hands and self-feeding, but not necessarily relying on that solely. And I think something that's appropriate for their developmental stage. And a big one here, which sounds so simple, is to accept mess. So the number of times, I was trying to feed my son, and my very lovely mother would sort of swoop in with a washcloth after every mouthful, and he's a messy kid, and that intrusive sort of behaviour is not necessarily helpful. And obviously avoiding that emotional feeding. So if your child falls over, they don't need an ice cream. And at the same time, if they're well behaved, they still don't deserve an ice cream. There are other ways we can reward children. And avoid praise for eating. Eating is something that we need for nutrition, we need for pleasure, it's good for socialising, but it's not necessarily that just because a child finishes a bowl of porridge, we need to sort of, go over the top congratulating them and that they're such a great thing. Like, just let them finish their meal and that's it. Okay, well, I'll leave it there, but thank you very much for your attention, and again, thanks to the organisers.
Thank you very much, Kimberley, for this very interesting presentation. So I suggest that we start the question from this side now, because I look more into the other direction. So are there questions on this side of the room? No, I don't see hands raising. Or maybe on the other side then? So happy to welcome questions. Oh yeah, okay. So Mike, please.
Well, I was going to ask everyone this question, so it's not just because you happen to be here, but
okay.
It seems to me that there are two players in this field, the mother and the child, and it can be complicated by the mother-in-law or granny and by siblings. But basically, let's focus on the mother and child. And the mother is, particularly if it's the first child, is a very vulnerable person psychologically. The mother is told this is the perfect way to do it, and it doesn't always work out that way. Now, I think the mother is sometimes not considered in this, or that psychological sensitivity of the mother needs to be taken into account a little bit more. The second thing is that the end point here mostly is, did the child eat fruit and vegetables? Now, I know you've talked about responsiveness and in relation to longer term effects, but we do need to look at more critical endpoints of infant nutrition, such as growth, physical growth, cognitive growth, emotional growth, and so forth, and work back the way and see, are there actually many, many ways you can get to these desirable endpoints? Is it necessary? I mean, I only started to eat cauliflower recently, and I'm 71 years of age. Hello? I think to be simply obsessed with particular sets of foods and not look at the overall development of the child and the preparedness of that child for toddlerhood and the toddler for childhood and the child for adolescence, I think that needs a little bit more thought. So I had to ask the question, so I'm sorry it's you, Kimberley.
No, that's a really good point, I think. So I'm not entirely sure exactly what the question was, but I think it's about, it's a nice comment. I think, parenting is not necessarily an easy thing to do, and I think that parents have a lot of different jobs that they need to, or think milestones for their child that they're trying to help their child get to. And so I think sometimes, feeding for certain mothers is not the priority. Necessarily, and I think that we do need to take into account other pressures on the family in terms of some of those expectations about how many foods they need to introduce by a certain point of time, and their child needs to eat an X number of fruits and vegetables, and I think that I've talked to some. I'm not a dietitian, I'm a psychologist, but I've talked to some dietitians and they said, look, children can thrive even if they don't eat their cauliflower necessarily. So we don't need to get them to like every single vegetable. But I do agree that we need to take into consideration a little bit more, I guess, the pressures on parents. And some of my work has extended to the role of fathers as well. So we're not just, looking at mothers-in-laws, but we've also looked at fathers and, in particular, comparing their feeding practices against their partners. And what we've tended to find is that parents are quite similar in their feeding, but that fathers may be more likely to use more kind of overtly controlling practices. So I think that that's something to take into account as well.
If I may add something to your response, and I think it's the identity function of eating that has to be taken into account also. And for instance, parents often report, I did exactly the same thing with all my children, but one will not accept courgette or zucchini, for instance. And but I think it also has to deal with the identity. And for some children, selecting food or not eating a food is also a way of displaying the expressions of self-identity, and that's very important for them. And parents also have to acknowledge this, and so that relates also to the cognitive or emotional development. So it's not just a problem of eating vegetables, but it's also a matter of expressing themselves. Sandra?
Thank you for that very interesting talk. I just have one question now, which strikes me for looking from at the talks before and your talk now. So we have this idea of introducing certain foods, particularly vegetables. And one of the recommendations was that, you know, we should make sure the child at least tries one of those. How can you reconcile that with the notion of let the child guide their eating, because otherwise we might have issues because we're overriding their internal responses, their internal need for certain foods or for food in general. And I think the other thing is here with the meal setting and the meal times. Now, I fully agree, we don't want them having, you know, their food in front of the television, but are we not overriding here potentially their own, this is when I'm hungry. So I might be hungry at 5 o'clock, but our family eats at 6 o'clock. So what recommendation can we actually find to kind of reconcile the innate needs and drives, which are clearly there, with some of these recommendations?
Yeah, I think that's a really good question. Just, I guess, the first point of that around, you know, the child deciding sort of how much to eat, you know, part of that though is the parent providing the food, and so the parent providing healthy, nutritious food for the child. I think that, you know, we also need to understand a little bit better, I mean, because there's been such a focus on controlling and non-responsive feeding, we don't know really to what extent any kind of encouragement can actually be given to, you know, perhaps get children to at least try or taste some things. In the UK, they've got the Tiny Tastes trial where children were given, I think, sticker rewards for at least tasting some disliked vegetables, and that seemed to have quite positive impacts on their intake of that vegetable. So I think that we need more research on that issue of, you know, whether we can offer encouragement and so forth to children without getting to the point where it's becoming a problem and could potentially override their eating. I think it's more that really pressure to eat and those very coercive feeding practices that I was more talking about. In terms of the issue of the structure of the meal time, that's a really, really good one. And, you know, the limited evidence we have is that structure is helpful for children. Certainly if children are offered regular meals and snacks, then the idea would be that they are offered those at, you know, reasonably regular intervals and can eat or choose not to eat at that time point. So I think that, you know, if children are provided with food at, you know, at different points throughout the day, then it's sort of unlikely that they're going to get to a point where they're desperately hungry. I think also, you know, there is nothing wrong with being hungry and having to sit with that feeling for an hour while you know, your parents are making dinner. So I would sort of say that I think that we can, you know, provide some structure without necessarily overriding that, you know, sort of innate hunger satiety cues.
We have one question on this side.
Yes, I'm Dr. Makalintal. With the intercultural marriages, and we know already that eating has an influence in the culture. With those intercultural marriages, they have different preferences, and we know very well that there is such thing as significant others who are actually pointing their fingers on what and what not to eat for these infants and or children. What would you recommend for this kind of family structure? Would you recommend for them to have some guidelines or rules, or who will take over, or who will be the one responsible feeding the child?
Yeah, I think this is an excellent question as well. I've conducted a few studies that have looked at feeding either in the milk period or sort of this early 2 to 5 year old age in families from different cultures. So we've looked at India and China, and both those living in their home country or in Australia as immigrants, and sort of the complexities of intercultural marriages, as well as the influence of that sort of the third generation. I think it's very difficult, and often, you know, if the mother is the one who we are considering as primarily responsive for child feeding in this early time point, in those sorts of situations, often she's not in the position of having that power to sort of make decisions around child feeding. So I think that in those instances, it's really important for health practitioners who may be, you know, coming in contact with those families to be able to provide some really clear guidance that's not going to be, you know, perceived as kind of threatening the authority of the other members of the family who might think differently.
Thank you.
Okay, there's one question here. Filipino parents find it cute to have obese infants and child. Do we advise them to reduce their meal intake or milk intake?
Thank you for that question. So I think that a similar kind of cultural perspective might also be quite prevalent in India. So one of my PhD students who her study was conducted on child feeding in Mumbai and also in Australian Indian immigrants, and there was that perception that a chubby baby is a healthy baby. So I think certainly, you know, educating parents on kind of growth charts, and I think particularly in that early period of time, you know, milk feeding practices. So if the child's not being breastfed, then, you know, what are the practices related to formula feeding that are going on, particularly in terms of, you know, overfeeding, you know, potentially, and other practices to increase the calorie content of the formula, such as adding baby cereals as well.
And one more question here before we go to the floor. Can you comment on sibling with discordant weight status? How should parents address this issue? Siblings with discordant weight status. They have different weights.
Different weights. I don't know if I can necessarily comment too closely on that. I know that there has been research that's looked specifically at parent feeding practices of children who are showing discordant eating behaviours, and what we found was that parents did feed the children differently depending on the level of, in this case, it was food fussiness. So I would imagine that similar kind of situations occur where parents might have children of different weight status, and they might be more likely potentially to use some feeding practices with one child or the other. And I think it comes down to we need a better understanding of whether some of those practices, such as perhaps restriction, are going to have maybe potentially detrimental effects, whether that's related to diet or the psychology of that particular child. So I think that it's an area that needs further exploration.
One question here.
I'm Dr. Manish from India. I have one question. Like, we have talked about the mothers, the mother-in-laws, and all other associated factors in addressing the fussy issue. There is one particular thing I've seen in my practice. When the parents come and tell me that when my child sits with other friends of his, say 5-6 children, then he eats well, or even there is a group, he eats well. So, is there something which can be offered that a fussy child, you ask the parents to make the child sit in a group of friends and he eats well? Is that a good idea?
Yes, it is a good idea. There have been studies that have shown kind of the influence of peers on tasting and trying new foods or foods that the child originally disliked. And certainly peers can encourage the child just through that role modelling to taste that food as well. So it certainly it is likely to have a positive effect.
So we have many questions on this side. So we'll start with the back. Sorry, for the people in the front.
Good afternoon. Thank you very much for your talk. From the first speaker until yourself, you've been emphasizing on the need on starting babies with vegetables. But as a pediatrician, maybe my concern would be on the nutritional gap. Like, when would you start these babies on cereals? And then, of course, with a potential risk of iron deficiency, would you start it earlier on as well?
So in terms of the infant feeding guidelines in Australia, it is recommended that first foods include iron-enriched infant cereal. So does that answer your question? Yeah.
And regarding cereal, for instance, just one example from France. Many parents in France don't give cereals to their children, and it doesn't seem to be an issue. I think there are many solutions to cover infant nutritional needs. So vegetable can be a solution. In that time frame, in general, children still continue drinking milk, whether it's breast milk or formula. So it also helps to cover their needs. And as you said, also the WHO recommends early introduction of iron-rich food in the diet. But in general, I don't think that they are difficult to accept for children. They are, in general, quite easy to eat.
Good afternoon. Are there any studies showing what influences the feeding practices of parents? See, for example, is it the doctor, is it media, or right now, social media for that matter? My thoughts there are, if we know what influences them, probably we could strengthen programs gearing towards that, but I'm not aware of any studies showing that.
Yeah, there have been studies that have looked at predictors of maternal feeding practices. Often they're considering things more along the lines of maternal education, age, weight status, dietary restraint, or their own weight concern. Less so in terms of those sorts of social media influences. With the Nourish study that I was involved in, we did collect data on sort of sources of information about parent feeding. And we haven't looked at that, but I think the problem with that is that was just before the advent, really, of social media. So it's probably out of date to do anything useful with. One of my students last year, she did look at maternal eating behaviours in terms of emotional overeating and food responsiveness, and they appeared to predict certain feeding practices like instrumental feeding and emotional feeding.
Me? Okay. My question is related to a previous question. And this is the role of the extended family, like grandparents, or surrogate caregivers like nannies, no? Because most Asian countries, like for example in the Philippines, there are a sizable amount of parents who are working abroad. So I'm just wondering if there are any studies that look into this.
Now, I think that this is a really under-researched area. There's just now emerging research that's starting to look at fathers, for instance. But certainly, in Australia, where I'm from, many children are go to like long daycare centres where at least 3 meals a day will be provided, if not 4. And there really isn't much research on what those carers are doing. So I think that that's something that we need to consider. And also, what we know from the literature with maternal feeding practices, how much we can generalise those same practices to, they would have similar effects regardless of who's actually doing them. I think that's still not known.
Yeah, thank you very much, Kimberley, for your very comprehensive review studies and presentation. My question is, since I know more about the obesity related in adult compared to the children. For instance, in adult, there is a current meta-analysis showing that lack of sleep will be increased ghrelin and also increased risk of obesity. Do you have any information? What about in children? Lack of sleep in children also will affect on the obesity among children.
Yeah.
Now the second one,
Oh, yeah.
as I continue the previous question, that like in Indonesia, in my countries, developing countries, there is a currently growing, that opportunity for the young woman to be get a job at the formal sector, while the salary is relatively low and cannot afford to pay for the high quality babysitter. And then when the young mom working at the formal sector, they leave it the children, the young children into the grandmother or the other people, or only for the babysitter only graduate from the primary high school. It is a big challenge for the Indonesia, it seems to me, when we learn this, not like in my age before when I have a children. I asked my wife to be please stay at home, and then after children going up after primary school and then can go work again. So what do you think, your suggestion for the low income level at the developing country? How can we improve the feeding practice for the children? Thank you.
Okay, that's great. In terms of your first question, I haven't personally done much research regarding sleep, but there certainly is a lot of interest in that and evidence to suggest that lack of sleep in children can be a precursor or is linked with obesity. I think, really looking at how that could disrupt eating behaviours would be certainly of interest as well. In terms of your second question, there's not going to be an easy solution. I know that there have been some interventions that have tried to focus on, these are in the US, that have tried to involve the grandmother if she played a key role in kind of raising the child. So we might, with, say, the Nourish study, we've been trying to, we recruited mothers because they would, in that context, be the primary caregivers. So I think it's about getting that same information out to whoever the primary caregivers are. I think the good thing is, and hopefully you agree with me, that those tips for responsive feeding, it's not that hard. I mean, they're not necessarily what we would intuitively do, but they're not particularly complicated either. So I think that message could potentially be packaged and delivered to sort of a wide range of carers.
I have a question here. One of the things you should look at affecting the appetite of children would be also their activity aside from sleep. So right now, our children, of course, are too active, and of course, when they are tired, they do not get to eat that much. Also, the exposure to certain gadgets has been looked at, particularly on the effect of appetite. Can you comment on this?
Yep, so when you say certain gadgets, do you mean like iPads and that sort of thing? Yeah.
The media, the screens, yeah.
Screens, yes. No, I think that, this is the real challenge in this area of research, to try to bring together, the nutrition aspects, the physical activity aspects, and then also the sedentary behaviours, which are now, often considered separate to physical activity. So that sedentary behaviour of, being on computer screens and iPads and so forth. So I don't have a good answer to you, but I think that they all need to be considered and how they interact, because clearly they all are going to affect the child's overall health.
Another question?
Yeah, hi Kimberley, thank you for your talk. Ku from Malaysia. I think it's related to some of the questions which had been raised earlier about dissemination of knowledge to the caregivers, because many a time you're in Malaysia, both parents are working, so the feeding is all much left to usually to the caregiver, not even to the grandmother
or the extended family. So, I mean, who is best positioned? I know we are all pediatricians, and but we can only see a certain proportion of patients. How best is it to disseminate knowledge of all this to as wide a population as possible? Do you all go into some sort of online presence, like an app or something, to educate, you know, patients, parents, caregivers?
Yeah, I think that there's probably, you know, the solution is probably multiple pathways to get that sort of information out there, particularly when we're talking about really updating our views on appropriate child feeding. Certainly, you know, with the advent of technology, whether it be apps or just through internet sites, that's one avenue that can hopefully get that out widely. I mean, I think that we've also, we have seen that the messages that we were delivering through the Nourish intervention, even though they were only to the mothers, when we assessed the fathers' feeding practices as well, we found that there were significant differences between intervention and control group fathers. So the mothers were under absolutely no instruction to, you know, tell their partners these messages. It was just sort of something that incidentally happened, and it appears to have changed their behaviours as well, so the father's behaviours. So I think that, you know, even if the first point of call might be to, you know, get this information to parents, if it's something that they can then pass on to the caregivers of their children, then that's, you know, something that I think will still be efficacious.
And to add on that, I think it's, I work a lot with daycare centers, and it's in south of Germany we have a program to educate daycare person to really start healthy eating, and that has a huge implication. And very often the digital or the WhatsApp even does not work at this time. They really want a direct approach and really interacting with each other. I think it's a very important point. And in the daycare center, we also have done a lot of studies because the interactive way of eating when they have lunch or also the Abendessen has a key impact that children eat just better because there's a group of children who eat together and they are stimulated by each other, which has a strong effect.
Yeah, I know. Now we will have the last question. I'm sorry for all of you who cannot ask the question.
Thank you. Dr. Kimberley, you pointed out that giving rewards to for eating well or completing your food is not good. At times we are visited by mothers who are really very pushy and strict about eating as well. They would almost threaten their kids of locking them in the room if they don't finish the food and leaving them aside or not meeting them the whole day if they don't finish the food. How do you tackle such mothers and what do you tell them? Even if the kid is not, you know, that malnourished and he's healthy looking, but you have the threatening mothers, what do you tell them?
I think that, yeah, you've got a bit of work to do in that case. And I would go with a gently approach. You know, I think thinking about, you know, talking to the mothers about why they're feeding the child in that way, so why they're so concerned about the child finishing everything, would be sort of a key kind of component to start that conversation. I think also, you know, talking potentially about the risks that excessive pressure might potentially have. And, you know, there is evidence that when children are pressured to eat a certain food that they can end up disliking it more. So that kind of information might potentially sway parents a little bit against that idea of really pressuring. But I think certainly it's about, you know, sort of understanding in the first instance why they're necessarily feeding that way, as well as providing the information about, you know, appropriate growth of the child and that and, you know, children's ability to self-regulate. And I think it's, you know, a mind shift in terms of, you know, being able to trust the child's appetite.
When we tell them that your child is actually growing well and you don't have to adopt to such behavior, and they say that actually he's doing well because I'm doing that. So he's basically a poor eater, but I threaten him and he eats, and that's how my family works.
Yeah, that's going to be tricky because if they're saying, well, they're growing well because this is how I'm feeding them, then I think you definitely just have to work on kind of making little changes and work towards something a little bit more desirable, perhaps. Yeah.
Thank you very much, Dr. Mallan. I think we have to close the session for time being.